I love doing breast revision surgery. We have some very interesting techniques, some wonderful kind of high-tech products we can use to help solve what are usually pretty complex problems. I'm going to show you an example of a case in which I did breast revision surgery. Of course, each woman's going to have her own history and findings, concerns, and desires, so what we do for someone else might be different than what I'm going to show you today. Today's patient is 75 years old. She has insulin-dependent diabetes, which puts her at a little higher risk for problems like infection and wound healing problems. She's had 10 previous breast operations. Many of those took place in New York, several by other surgeons in this area. She has capsular contracture of her right breast implant, and you can see that in this photo. The right breast implant is higher than the left. There's a little bit of an indentation in the inner aspect of the right breast. The left breast, while you can't feel it, the left breast is very soft. The right breast is very firm. In today's case, I'm going to use a biologic mesh product called Strattice. Strattice is basically pigskin, but very high-tech stuff. They've removed all kinds of cells that might create inflammation. This allows this collagen product to serve as a regeneration matrix into which your own tissues and cells will grow and maybe even eventually replace the product altogether. It's been shown in many studies to help minimize the risk of hardening or thickening of the scar tissue around a breast implant. It can really help minimize the risk of capsular contracture developing again. To help get her back to a softer, more symmetrical breast, I'm going to have to start by removing the thickened, hardened scar tissue capsule that's developed internally around the right breast implant and remove the right breast implant. We call that a capsulectomy. I want to show you a few short video clips of how that's done. Here you can see I'm using a cautery device to dissect the breast implant and scar tissue shown below from the muscle and breast tissue shown above. A little further along you can see the retractor holding the muscle and the breast tissue above from the capsule and breast implant below. From a different angle now you can see the backside of the breast implant and scar tissue capsule being dissected away from the chest wall. Here you see the breast implant and the scar tissue capsule that I just removed from this patient. The next step is going to be to open the Strattice biologic matrix and then to bathe it in an antibiotic solution that also contains some betadine. I've sutured two pieces of the Strattice together, and now I'm suturing that to the bottom end of the pectoralis major muscle. The breast implant is going to go behind the Strattice and behind the pectoralis major muscle and breast tissue. The Strattice is lying on this drape called ioband that prevents the Strattice from touching skin or any other drape material. The breast implant comes sealed in two different plastic containers. Here we are opening those containers to get the breast implant prepared for use. I bathe the breast implant in betadine, swirling the betadine around to make sure it's in contact with all surfaces of the breast implant. I'm placing the breast implant in the breast pocket behind the Strattice, pectoral muscle, and breast tissue. The extra Strattice is going to be trimmed away. That's how I did this patient's breast revision surgery. Here you can see the before and after photos. Notice in the after photos how the right breast looks much more like the left breast. We don't have that indentation in the inner part of the right breast anymore. Both breasts are very soft, look good. She just loves it. She's a very happy patient. If you've been thinking about breast revision surgery, we would love to see you in our office in Fort Worth. In Fort Worth, keeping it beautiful, I'm Kunkel.